Good morning, everybody. Welcome to today's webinar on governance in a pandemic. My name is Frances Walsh and I'm PlayBoard's Regional Coordinator for School-Age Childcare. Today's session is going to be recorded, so we've switched off everyone's camera and microphone to reduce the background noise and to ensure GDPR. We'd ask you to use the chat feature to submit any questions that you might have as we go through the presentation. And I'll do my best to answer those at the end. So lockdown is something that none of us ever expected to happen, but it did. And the unfortunate reality is that it could very well happen again. We're seeing a kind of a circuit breaker at the minute. But if it's not due to COVID-19, then we're also talking today in the context of some other illness which has the capacity to become a pandemic in the future. And now we've gone through the experiences which 2020 has brought to date, you need to prepare for and safeguard your business against a similar scenario in the future. And that's really what the focus of today is. I know for many of you, the impact of COVID-19 was that you were forced to close your doors. But the point I want to make today is that it's your premises which close, not the actual business. Delivery of childcare may have been suspended, but the governance continues. So the focus of the presentation is, if you were to experience another lockdown, which some of you are currently, what do you need to think about in order for good governance to be maintained? My plan is to explore some of the key areas and main procedures that you will need to review in order to prepare your business for any temporary closure or reduced access in the future. The first thing that I'll say is that this is not a job for one person. In order to prepare for another situation similar to what April, May and June brought us, your organisation will need to identify a team of people to deliver on the tasks which we are going to discuss today. And the lead body in that are your management committee or your board of directors. Sorry, I'm just trying to move the slides on here. There we go. So let's get into it. To back up that statement, we're going to take a wee look at some of the areas which you will need to review in order to prepare the business for future disruption and potential suspension of the childcare service, either through lockdown or if an outbreak occurs in your setting and you may have to close for a short period of time. So these are the areas that we're going to discuss. We're going to look at finances, policy and procedures, premises and staff, communications, service users, your parents, your children, etc. All the light-hearted stuff. And in order to deliver on all of these areas effectively, the management of your setting will need to show leadership. They're going to need to step up to the bar. Taking control of the situation and showing leadership will reduce the uncertainty and it'll minimize the fear amongst your staff team and your parents. If you take the time to implement the steps that we're going to discuss today, your committee will be better prepared for any future pandemic situations and will be better able to show the staff team that the situation is in hand. That will instill confidence in their employees and in the service users. So, the finance, we're going to look at what needs to be considered and what is it that you need to know. So this presentation is about governance in a pandemic, and since the only pandemic we've known is COVID-19, I'm going to use that experience as my reference point when I'm talking today. The impact of COVID-19 on the finances of childcare providers, it's been profound. And having to suspend the service for a number of months during April, May, June, it cut off your main supply and in some cases your only supply of income. I'm stating the obvious here, but reduced income reduces your capacity to deliver. So it's absolutely crucial that you know the current financial status of your business. So you need to know what cash is in the bank, how much of that is committed against specific costs. Do you know your margins? Do you know what you need to have coming in, what you need in the bank to cover your outgoings? Can you project expected income and non-escapable costs? Do you know what reserves you have? Unrestricted reserves. Reserves are funds that are held back usually to see the organisation through the rainy days. And in a pandemic situation, as you all know, you need a very large umbrella. You need to know what grant funding is in place and which parts of the business that covers. You should be contacting your funders to see what their plans are and to do that early on. You need to know whether or not you have overdraft facilities, what is the limit of that overdraft, and what are the repayment rates that you have to cover. In order for the committee to prepare to handle the business finances remotely, you need to be aware of the organisation's financial health. Basically, you need to know the ins and outs of your business, the nuts and bolts. So how do you find out what you need to know? And these are some of the things that you need to be aware of. Pandemic or not, your committee should be given a written finance report at each committee meeting. And it's vital that the management is kept fully informed. The committee members are legally responsible for the finances for the business, so they have a right to ask and a right to know exactly what is happening with the organisation's finances. If you don't currently present written financial procedures, then as part of the preparation for governing in a lockdown situation, you need to establish that practice. You need to undertake a review of your budget forecast. At the start of each financial year, your committee should agree a budget. In a pandemic situation, the committee needs to undertake an urgent review of those forecasts, the financial projections, because it's certain that they will have changed. So they need to know what expenditure has been forecast each month and what now needs added to those figures. For example, if we use the COVID-19 example, it was with extra cleaning materials, extra staffing hours to cover the cleaning and also to cover sickness, that kind of thing. And they need to add in the additional costs that you're going to have to meet. So you can see how projections will change. Consider whether or not there are any costs that can be reduced, even temporarily. For example, maybe if your contracts allow you, you can look to renegotiate with suppliers. For example, maybe mobile phones, you're coming up to the end of a contract, or your broadband. Can you look to get reduced costs there? Has the income been reduced? Well, we'll assume that it has. The projected income against parental fees will more than likely have been reduced in a pandemic situation. The level of reduction will depend on whether the situation is a full lockdown or partial lockdown, partial reduction. The setting remains open, but the numbers are down. How much revenue from fees is actually coming in? That's what you really need to know. And that's why you need to know your actual break-even point. What do you need to have coming in to keep the doors of the setting open? So the income from parental fees has taken a dip. You need to stay informed on any government subsidies that have been made available. With COVID, we've seen the job retention scheme, we've seen bounce back loan, we've seen business rates relief, we've seen child recovery grants, among others, have all been put in place to try and keep the wheels on the bus, to try and keep settings, businesses from going to the wall. Now that money won't just fall in your lap. You have to actively look to see what's out there and apply for it. So you have to maximize your uptake. And the way you do that is, first of all, actually being aware, go looking for what is available and get in and apply for it as soon as you see that it's there. You also need to look to see what other relevant funding grants are available. Use the time to make applications. Whether it's for £500 or £5,000, if you can secure funding for things such as resources and activities, that means you have greater financial resources to divert from your parental fee income, which can be used to cover your higher outgoings such as salaries. Again, find out if funding that has already been granted to your organisation is still going to be released. Plan for the medium, longer term future. You're not just looking at the short term picture here. You must consider the medium and longer term outlook for the business, and you need to plan for a variety of scenarios. No one knows if lockdown will be extended, so you need to plan as if it is. Okay, you need to look at your worst case scenario and all the other scenarios which might come up in between. Meet regularly. In order to undertake these tasks effectively, your committee needs to meet regularly. If the normal time frame was once a quarter, consider stepping that up to once a month until the books are looking a bit healthier. And remember to record all decisions within the minutes of the meeting, because that will be a vital reference point as you go from meeting to meeting. Ask for advice and act quickly. Don't wait until the last minute to act. The longer you wait, the further your options are reduced. And don't be afraid to ask for advice. Talk to your accountant and talk to your funders. See what they have to say and act on that advice. Okay. We could spend an entire presentation just on the finances alone. But that's a webinar for a different day. So I'm going to move on then to looking at policies and procedures. Everybody has policies and procedures in place. You have to have them as part of the minimum standards. But when those policies, procedures were originally drafted, they were developed for non-pandemic conditions. And good governance recommends that you review your policies annually anyway, just to reflect any legislative changes, but also to reflect any general changes in your practice. And you know from COVID-19, that experience, that your practice has changed. We've just spent time there focusing on the financial end of things, and that's one of the policy documents that you'll need to review and update. How will your financial governance be maintained if you can't access the premises? As I say, premises might close, but the business isn't closed. The business and the governance of that business has to go on. So how are you going to maintain those governance practices if you can't access the building? How will your committee meet? How and when will the paperwork for meetings be disseminated? You know, right now they might just come to the board room or the playroom or whatever it is, but if you can't access that building, what is the alternative there? How will the finance officer access files, etc., if the main computer where everything is stored or all the paperwork is sitting in the office? How will the finance officer's work be verified and payments authorized? What if your finance officer becomes sick with the illness associated with the pandemic, be it COVID or whatever else, and they're not able to do their work? What happens then? How do you maintain the necessary level of financial scrutiny? The committee have a duty to act in the best interest of the business, but even so, fraud can still occur. And it's something you need to consider in terms of risk whilst governing remotely. Indicators suggest that poor internal controls not applied consistently, over-reliance on one person, and a lack of challenge and insight makes businesses vulnerable to fraud. And these indicators pretty much fall under the things that we have been talking about today. So you need to widen the safeguards that you already have in place to cover any risks which may occur as a result of these changes and circumstances that are brought about by a pandemic. You need to really consider that, because it could happen probably easier than you would think. So remote home-based working. It may well be the case that part of your staff team have to work from home. And we're talking about potentially your finance, your admin team, that sort of thing. And you need to consider what that might look like and draft a policy. In PlayBoard, we're lucky to be on a network system that we can all link into remotely, but you may not have that. So the question is, you need to think about for your policy is, how will your staff work from home? Will you supply an adequate laptop for them? Will you host meetings via Zoom? And if you do go down this line, you have to remember to protect that laptop from internet hackers or viruses. You do have to maintain confidentiality. You do have to maintain GDPR. And we'd recommend that you install a password on any device and ensure that you have a good form of internet security in place. Consideration needs to be given to how you're going to communicate with your staff that are working from home. And importantly, how will you continue to support them and prevent them from becoming isolated? Particularly in the lockdown situation that we've seen in April, May, June, we have heard of organisations where the staff, nobody went near them for those 3 months. As with COVID-19, social services may require you to develop a policy that is specific to the pandemic. So you need to use your experience of having had to do that for COVID. And it's likely that a lot of the same issues will need to be reviewed, such as school collections, the pick up and drop off of children, access to the building, infection control, etc. And you need to seek advice from them as to what guidance they're putting in place, and you need to follow it. Just as we've discussed development procedures which govern staff as they work from home, good practice would suggest that you also consider the return to work. How are you going to manage that? And again, this is an opportunity to show leadership to your staff team, to show the team that you as a manager have gone to the trouble of ensuring their safe return to the premises. And this can set out that you've undertaken a risk assessment. You can share your risk assessment with your staff team. You followed PHA guidance, but it also sets out to your team what their responsibility is to each other. It places an onus on your staff that it's not just the management's responsibility. Health and safety is everyone's responsibility. And so we all have to follow proper procedures in an effort to maintain the safety of our colleagues, as well as the service user, your parents, your children, that kind of thing. In PlayBoard, what we included in ours was, we included what was to happen if staff went away on holiday to restricted countries, despite government advice not to. That kind of thing. We've tried to think of different scenarios in order to minimize the risk, in order to prevent the spread and transmission of the disease. You can also set out things in the policy, such as how deliveries are to be handled, and any procedures such as hand sanitizing on entering the premises, maybe taking their temperature, wiping down equipment after use. You'll likely establish social distancing, and you'll limit how many people are allowed in certain areas, for example, your kitchen, maybe your staff room at any one time. And this is your opportunity within this policy to inform your team on what changes have been implemented during the closure that they will be expected to adhere to when they actually return to the setting. Okay, so now we're going to move on to premises, personnel and programme planning, and some things to consider there. Risk assessment. So again, as with COVID-19, in any future pandemic, you're going to be asked by the trust to develop a risk assessment, to set out the steps that your business will take to limit and prevent the spread of the disease associated with the pandemic, whether it's COVID or whether it's something else. I would say that shouldn't be left to the leader, and unfortunately the experience seems to be that a lot of the leaders were left to carry that task forward. Under the Health and Safety at Work Northern Ireland Order 1978, there's an obligation on the committee to provide a safe working environment for staff and also to ensure that it's safe for the public. The committee should work with the leader to develop this. There will be a cost associated with this risk assessment, and the committee have to approve that expenditure as part of the budget forecast that we talked about. I did a webinar back in August that is available for anyone needing more information on carrying out a risk assessment, and that's available on our YouTube channel. So prepare the building and the premises. As part of the risk assessment, we would suggest that you do a physical walk around your premises and look for the hotspots. Where are people likely to gather? Where will you need to place signage? Where will you need to place sanitising stations? You need to deep clean and declutter the building before you reopen it. And you need to remove any unnecessary furniture so as to accommodate social distancing. You need to ensure that all your hand washing facilities are restocked with paper towels, hand soap, and sanitising sprays, that kind of thing. Set up cleaning stations in areas that will see a lot of footfall. For example, door handles at the entrance to the building, photocopier machines, those types of things. And also think about children's safety by storing those products out of reach. You'll also need to make sure that you're aware of any guidance published by the Department of Health in regard to registered childcare settings. You know that that exists currently with COVID-19. They may have specific instructions that you must follow. And undertaking this effort, it not only complies with requirements, but it helps again to instill confidence in your staff and your service users. And you need to repeat this after each period where the building is vacant for a time. So if the building has to be closed because someone or a child has developed symptoms and you need to close for 2 weeks before you reopen, you're going through these steps again. So we're going to move on then to staff and personnel. So if you've been closed, you need to find out if your staff are actually able to return to work. Are they self-isolating? Are they in the vulnerable category, and do they need to shield? Who can return immediately and who needs a bit longer? Find out how that period of lockdown has been for them. What are their concerns? Can you alleviate them? And very often a robust risk assessment is one way that you can help them to feel safe to return to the setting. In a childcare setting, having staff that need to work from home, that can be difficult to accommodate. And depending on their level of responsibility in the organisation, can you maybe give them policies to review? Can you maybe ask them to do some programme planning? Maybe update social media if they're not actually in the building and working with the kids? Can they even help in research and potential funding resources? What else can they do if they're not on the premises? All staff should be fully briefed on the plans for reopening the building. They should be informed of all protocols, policy updates and measures which are to be put in place to reduce the transmission of the disease associated with COVID or any other pandemic. Senior staff need to ensure that these measures are understood by all personnel, because again, we're seeing deaths rising here, and in a pandemic situation, in terms of risk, that's your highest category is death. So we really want to prevent that, so that your staff need to know what their responsibilities are. You need your staff to be confident that the premises and the program basically has been pandemic proofed, because that will feed through to your parents as well. If your staff are nervous, your staff are a bit jittery, you're not going to instill confidence in parents to leave their children there. You also need to plan for the scenario where it's a partial lockdown and the childcare is maybe still in operation. And you need to consider, like, for example, what if a staff member has to isolate or become sick? You're all likely dealing with this at the moment, and it's a heavy burden because you have ratios that you need to meet. But you need to plan ahead so that you know who you can call upon to fill in at short notice. And again, you're going to have to budget for those additional staffing hours within your financial forecast. Another reason why you need to be alert for any and all grants which are available to your organisation. What other money is out there that can help you to meet these additional costs? Because it's likely that these are inescapable, and you're going to have to find the money to keep those wheels on the bus, so to speak. Planning the programme is a task that the committee will assign to the staff and to the leader. However, It needs to be planned in the context of any guidance issued by Department of Health and in line with the risk assessment that you have drawn up. For anyone who missed we did a planning for summer play webinar back in July, and we did that in the context of COVID-19, and I think it was version 3 of the guidance at that point. But that was recorded and it is available on our YouTube page if you want to go back and access that and maybe find some ideas in terms of program planning. So now we're going to look at the children and parents. Your bread and butter, bums on seats, is literally what pays your bills type of thing. It's important that you consult with your parents prior to them returning. For a number of them, their circumstances may have changed during the period of closure. They may have had a family member become ill or worse. They may have lost their job, or they may have been subject to their working hours being reduced. Your own business is going to be in recovery mode, and in order to recover, you need parents to start using your service again. And you can't just assume that it will be business as normal. Whoever was there before we locked down will be there whenever we reopen. Parents and children's needs will likely have changed, and you need to respond to those needs, and you need to adapt where you can. Can you accommodate those changes? Maybe parents will need a longer time frame to return due to them or their child having to shield. Maybe they lost a loved one during the lockdown and just aren't ready to go back to the setting just yet. Can you keep their place open for a couple of weeks? Can you adjust from them taking 5 days down to 3? Can you adjust for them needing shorter hours in the day? What can you do to adapt to meet their needs? Because you want to keep them on board. You need to still keep the money coming in. And unless you reach out to your families, you won't know what their experiences are. And it's only when you know that you can plan ahead. You need to know who's coming back and when and for how many days each week. So keep in touch. And a great way to do that is via your social media. You can show pictures of cleaning products, of masks and gloves. You can show risk assessment template, pens and highlighters, images that show that your organization is taking the reopening process seriously. Again, you're trying to instill confidence here in the parents that are returning. You can do a screenshot maybe of your staff on a Zoom meeting, maybe all waving at the camera, all kind of a collective greeting to your parents and to the children. You can post regular updates, and in particular, this is a great way to keep in touch with your children because you need to prepare them for returning to the setting as well. Not every child will have had a pleasant time away in lockdown or self-isolation. The child may have a real fear of returning because they've been exposed to fearful news coverage and anxious parents. We were just talking today about the news coverage at the minute would just make you want to turn off because it's all gloom and doom. It's scary. And if a child was to see that, you need to let that child know that their favourite people are still there, bursting to welcome them back. You can post a video tour of your premises showing any changes that you've had to make, but using playful language so that the children don't feel afraid of those changes. One of our groups had a lovely series of videos posted during lockdown where each member of staff posted a happy video message to the children, telling them how excited they were about them. You know, they would be seeing them soon and couldn't wait to get back in, and all the fun things that they'd planned when they were going to be together again. It's an easy enough thing to do, but it makes a huge impact on the children. If your setting has been closed for a long time, then you'll want to ensure that your contact information is up to date. Because the people who were previously authorised to do the family's pickups or those who were designated as the contact person in an emergency may not be able to fulfil that role. They could be in the vulnerable category, they could be shielding, and you're phoning them to come and pick up a child and they can't go out. So you need to tie in with your parents to see that that kind of information is still relevant and up to date. Keep it fun. Again, if we're having a hard time understanding coronavirus, understanding a pandemic, how much harder must it be for children? Part of the reaching out to parents has to involve the gentle asking about how the children have been during the time when the setting was closed. The children may need additional support to readjust to returning to the club, and play is the ideal way to do that. They need to feel safe and welcome. You know, they might have heard about all these germs and different things, so they may be a wee bit cautious about going back into the set, particularly if mommy and daddy aren't allowed in to leave them in. They have to, you know, be collected at the door. They know something has changed, so you need to help the children to readjust. Good play experiences will help them to de-stress and allow them to have a sense of normality during the time that they're with you. And we have some great resources up on our website that you can download. Go and take a wee look. And I'll be sending out a few things to everyone today in follow-up to the actual webinar. Communication. This is a slide which has come quite late in the presentation because it's really threaded throughout everything that we've talked about, and it's interconnected with every step of the process. We've seen from our COVID experience how easy it is to get disconnected, and disconnection can lead to isolation, it can lead to uncertainty, it can lead to fear. Part of the planning process for you and how you're going to govern in a pandemic situation has to include plans to maintain communication. Within the committee, how will they communicate? Between the committee and the staff, what plans are you going to put in place there? Between the staff and the service users, your parents and children. We've gone through furlough. And a question to ask is, do you know whether or not your staff that were on furlough actually felt cut off and out of the loop? Did you check in with them regularly? Did they still feel connected to their colleagues? Don't get so busy dealing with the nuts and bolts of the business that you forget your key asset, your staff team. In PlayBoard, we set up a virtual tea break each day. We held regular staff meetings via Zoom. And at one point, just to boost morale in the sector, we held a fun game session for projects. Consider ways to reach out to your staff when you can't physically be together. Meeting up via Zoom allows you to keep them up to speed with the plans for reopening, allows them an opportunity to ask you questions. It helps alleviate uncertainty. Likewise, you need to keep your parents in the loop. They too need to feel assured that everything that can be done is being done to make the setting safe for their children. You have due collection and drop-off procedures. You need to inform them of what those are. You would have new illness infection procedures. You need to tell your staff and your parents what those are, what they can expect from you, but also what you expect from them in order for them to play their part. Go through any other relevant policy procedural changes. You need to communicate that. Your risk assessment plans. You know, you've spent all this time pulling together a risk assessment. It shouldn't be just a paper document that just sits on a shelf. You need to explain what those additional measures are, because that's what you've put in place to keep everybody in the building safe. And again, staff need to know what's expected of them. Same with parents, whether that is where parents aren't allowed to enter the building. If a child exhibits symptoms, what the parents should be doing in that scenario. You need to inform any suppliers of changes made in regard to deliveries of cleaning products, hygiene supplies. If you're putting on-site access restrictions in place, you need to let them know this is how we're doing it now, type of thing. We wrote that into our return to work policy so that all the staff would know, particularly those that are in reception who tend to see people calling to the building, here's what the process is if someone now comes. Again, let your children know that you're excited to see them again soon. And share your hard work. Make a short video tour with your phone. Share it with your children via your social media. And you'll see there at the bottom, communication be it verbally via phone calls, be it talking to people, virtually via Zoom, via WhatsApp video call, use printed material, and via your social media. But as I say, it's woven throughout everything that we've been talking about today. So it is a key part of the process. And finally, 3 absolutely crucial points. You need to plan what needs to be done. You need to delegate the tasks, but remember, overall responsibility does lie with the management of the organization. You need to deliver on the tasks. So you need to review and adjust those budget forecasts. You need to amend the policies and procedures which need change to deal with pandemic conditions. You need to get informed on what the PHA are saying, on what the Health and Social Care Trusts are saying, on what funding has been made available. You need to write your risk assessment. You need to write your return to work policy. You need to deep clean and ready the premises. Contact your parents, find out what their needs are, be ready to adapt. You need to communicate your plans. You need to reach out to the children. You need to reopen the business. Then you need to review those plans. You need to continue to review that budget, review your risk assessment, because guidance changes. And then as that guidance changes, you need to ask what needs to change in the budget, what needs to change in our risk assessment, what new announcements have been made which impact those plans. Update and change them. And once you do, share them with your parents, share them with your staff. Be vigilant. You need to react and respond to changes. And if you can adapt quickly, then you'll fare better in the long run. You need to give your business the best chance to emerge and recover. And basically that's it. That's the whistle-stop tour of governance in a pandemic. And I'm aware that I've given you an awful lot to think about today. I will follow up by sending out the slides that you've seen in the presentation. And I'll also have some useful information that we've developed a little COVID pack that we've put together, and some information that we think that you'll find useful. So keep a wee eye on the inbox, and we'll be dropping those things into it.